Assalamu alaikum. I'm Dr.
Assalamu
Muhammad
alaikum.
Azzam from Critical Care American Board. Just came back from United States to Jordan.
Yes.
And I'm working currently at Saudi Hospital as head of Department for the Pulmonary as well as the Critical Care. So I would like to know what's new in the technology of treating sleep apnea.
Yes, as we all understand, it's a big problem, sleep apnea, or sleep problems altogether.
100%, it's like 20% of the population who have the sleep apnea. And unfortunately, it's very, very underdiagnosed
Yes.
worldwide. And we'll see how it will go.
Thank you so much for taking the time, you guys. I understand how valuable your time is. I just know that this means the world to me, that you're carving the time, bringing your interest. I hope that I can give you some direction. And we are just starting to bring teams together, and we need all under the same roof, tackling the same disease, because that's where really the enjoyment begins, right, Jeannie? Excellent. Wow.
Okay, so it's Ahmed Barjous, ENT surgeon in Abdali Hospital. Worked 12 years in the UK. Of course, we have good experience in sleep apnea, children and adults, struggling with adults more, I agree. Here to learn more and hear more from experience regarding sleep apnea.
So is currently sleep a part of your practice?
So yeah, we always see patients with sleep apnea. I think they present a lot to ENT surgeons.
Yeah.
And because they think we got the magic in our hands. And I think we've been doing the uveoplasty a bit more. We've stopped doing it. And I think if things are not very clear, that surgery is helpful. We always think about doing other things.
Yeah,
Okay,
exactly.
good.
Exactly.
Or
Thank
the
you.
or the recurrent sinus.
That is
disease
all
they are having from the obstructive sleep apnea. It's
Exactly.
misdiagnosed as recurrent sinusitis. I'm getting treatment with antibiotics, decongestant, all these things, but it is more from the obstructive sleep apnea from my pulmonary standpoint.
Breathing disorder. And you said you were in USA. What part of USA?
New Jersey.
So you're board
I'm
certified in
part of
USA?
the faculty of the pharmaceutical care at St. Joe's for 8 years.
Wow.
And I just left back to Jordan.
Excellent. So you live here?
Currently, yes. But still I go back and forth, but
Yeah.
my main practice now.
So I'm going to be joining him when it's on the airlines. I know. Just the fact is, honestly, I think the whole world is suffering. And we have all been in our silos. And meetings like this should be packed stadiums of providers that are also patients, mind you, and talking the same subject. So I'm really excited about what I prepared for you guys. I try to dial it down and not make it dental, but you guys are going to quickly figure out why dentist is dead center of all of this. Not because I'm biased about it, because not true, but yes.
Yeah. Good evening. I'm Dr. Imad Al-Bdour. I'm a prosthodontist. I work at in the Royal Medical Services. We deal with a lot of cases referred to us from ENT department and maxillofacial department to deal with sleep problems and obstructive sleep apnea. Usually we use the mandibular advancement appliance or if edentulous patient, the pulp appliance. And I'm keen to see what updates we have in this part here.
Great. Nice to meet you. I'm Dr. Stoney. Have a seat. Pleasure to meet you.
Hi.
Yes, go ahead.
Welcome to Jordan.
Thank you.
I'm Dr. Mahmoud Darras. I'm a prosthodontist. I'm working since 17 years. Most of my work goes to the cosmetic part. So as we see most of the patients with seeking cosmetics, they have problems after treatment, after we give them the cosmetic treatments. And it's also, all of them are related to the bite and sleep and these problems. The problem that I believe that the bite is the key for
You're right on
everything.
that one.
Yes, it's
You
the
already
key
are on the right
yes,
track.
Yes, it's the key for everything.
Yes.
It's the key for most of the problems, especially sleep problems. And that's why I'm here, because I hear that there's something new in this area.
Yes.
So I want to improve.
I'm
my
telling you,
practice.
prosthodontists, we have orthodontists. You guys are in for a good treat. because once you learn the things that you can do in the mouth to treat the breathing disorder and then do your dentistry, watch out, world. Because I've treated some cases that I tell you, people thought that they were beyond help, and just minimal changes, it just opens up the system. And just staying open-minded, right? And that was me 5 years ago, by the way. I was in the same exact position as you are. So I'm bringing you the concentration of 5 years and then some. And that's decades before me, but the interdisciplinary aspect. So yes, doctor. We have a quick microphone. Just tell us who you are, what brought you here, what's your scope of practice.
Just introducing ourselves.
yes.
I'm Dr. Sultan Jaber. I'm an ENT doctor.
Yes.
I've been practicing for 5 years. I did a significant amount of work with obstructive apnea and breathing problems, especially tonsils and nasal problems and soft palate. So I'm still developing in this, and I've dealt with Noam a few times, and pretty satisfied, and hoping to grow our friendship and the work we do together along
Yes.
the years.
Nice. So at this point, other than tonsillectomy or U-triple-P, I heard that too. Do you do U-triple-Ps yet?
I don't do U-triple-P.
Yeah.
No, I
Okay.
do not, because we've had some mixed results. But
That's exactly what it is.
there's other surgeries that might be for some people,
Mm-hmm.
including barbed wire pharyngoplasty.
Mm-hmm.
That is a more successful operation, but it depends on the kind of disease. There is
Correct.
the kind of collapse in the pharynx. This is a whole field in ENT which requires 1 or 2 years of practice.
Correct.
So I'm still not fully in there, but I have a foot inside. So maybe at some point in my
Just
years.
curious, is treating the tongue or addressing anything around the tongue a part of your ENT training or practice?
Not a part of my training or practice, but I do look into it.
Okay.
I am actually actively I have been looking into it for a few years, and it's probably the first thing I considered with obstructive apnea.
And is are the surgeons doing the hypoglossal nerve stimulation Inspire? Is something? Not yet. Yeah, you're not missing on anything, but just was wondering what the scope is.
It's usually done by head and neck surgeons.
Yes.
This was referred to me by one of the Australian ENTs who worked exclusively with obstructive apnea. And when I spoke to him about it, he said they're usually sent to head and neck to do this. But it's
We have
something I
not
would
seen
love.
great
to learn.
results with that, and there's been recalls on the process, and it's very expensive. And I know in USA that used to be right after CPAP, but before they try that surgery, they have to show that they failed mandibular advancement or any oral appliance therapy. So there's way better options to stimulate the hypoglossal nerve and the vagus nerve. Way better, non-surgical. At least we could try this, right? If they fail, we can always do surgery. But surgery is not reversible. I mean, I guess you could remove the hypoglossal nerve, but either way, we have doctors here that are saying, I'd rather do it non-surgical. That's just music to my ear. So you're young, you got your own ways of figuring things out. But I'm glad that you're here for hearing a new perspective. So if you do, I'm here to answer any question you guys. And I have pretty much been dealing with all the other specialties, and I have patients that have been treated and failed treatments the last 5 years. And I kind of have a few perspective on that. Thank you so much for coming.
Most welcome.
Yes. Yeah, well, thank you.
Thank you. Hello.
Yes. Go ahead.
First of all, welcome to Jordan.
Thank
I've been
you.
following you for a while. I met you in Dubai before. I'm Samar Hassouna. I'm an orthodontist.
Yes.
I've been really curious about the appliance since I was following you, because the way it works is different from everything we studied, the mechanism and the jaw expansion. So I want to know how it works. Breathing is a major issue in my practice. Breathing problems, jaw expansion, mandibular advancement, all of that. So I think it relates. So
Now, do you see mostly children, or do you have adults also coming for second round?
I
ortho?
have like from 9 to 60. It
Okay.
does, yeah.
But what is the bulk of your practice? Is it mostly children or adults?
It's mostly teens early 20s. That's the most.
Do you do
But I
any-
have all around.
Do you do any bicuspid extraction still, or do you have
Sometimes,
pieces? Okay.
sometimes. Actually, we try to not extract. Nobody likes extraction, but sometimes we really have to.
Yeah.
I understand your perspective from
Yes.
that.
Like I said, I have reversed a lot of them, which is why it's really nice to have an orthodontist here, because at any age, we can increase the tongue space first and then aligning the jaws. Jeannie, do we have the skull here? I know we're missing a bone. I would like to provide some perspective here for you guys. And I'm actually...
The thing is, it's like we're taught after 15, we cannot do expansion except with the MARPI. I'm sure you're aware of that, by the mini screws. And it's a very challenging procedure. So that's why I'm very curious how this removable appliance works and how it would prevent extraction.
Yep.
So I've been curious for a year, and I'm very happy you came to Jordan.
I'm happy to bring that to you. And I'll tell you, you will hear this continuously from me, that it's not just the appliance that works. We're employing the entire body to get the tongue to seal the roof, which the tongue will do the job. Because if the mouth does not work, the body is falling apart. So that's why we work in an interdisciplinary environment. So could this be the tongue is low postured because of allergies, or tongue is low postured because of the restrictions in the frenum that's connected to the diaphragm and all the way to the toes? Is the posture hung forward? Did it have a kyphosis or a forward head posture? The answer is we don't know. But we all treat things the way we've been taught, right? We went to the school, they taught us one way, and now you're here learning a different way. And it's okay to change your mind in a light of new
Yes, of
information.
course. That's why we're here.
And you know what, you guys make me excited. This is why. I mean, honestly, I'm moving out of the United States, so I'm there with you. The open-mindedness I get on this side of the world, I don't get over there. In the wildest dream, I wouldn't imagine to have 3 ENTs in the same room. I haven't had that chance. They don't even talk to me. They think mouth breathing is just as okay as nasal breathing. There are not very many of them that are open-minded to know to correct the posture of breathing as a means of prevention. But that's really what I'm going to talk about tonight. That's all here. All of us are doing one way or another. If we're doing the right thing, is to get the most important organ, your entire body is the tongue, to get it to the roof of the mouth and do the most important function, that is the breathing, to be proper. And that's it. If you can make that work, all the other problems will take care of themselves. Guarantee you that.
Yes.
Thank you. Thank you, Nader.
Thank you, Doctor.
Well, I'm Shuruq Al-Jibouri. I am a psychometrician doctor. I'm so interested to be here because I need to learn more. When I served as a CBT therapist, I observed that lack in sleeping affect directly on the well-being. So I observed the relationships between lack in sleep and anxiety, depression, and other disorders. So I'd like to thank you for giving this interesting topic.
Well, didn't I tell you that like the angles? I'm actually going to add, while you guys are doing that, couple of slides. I thought, I want to see the scope of the audience. I want to add it, but I'm going to go ahead and add it over because I think you guys will all benefit from that, because I don't want to talk dental and I don't want to bore my audience, but this audience is really nice and vast. So hopefully you're going to walk away and saying, yeah, mouth has something to do with it. Yeah, in many levels. And CBD is the only thing you do is cognitive behavior therapy, right? Dialectically. Do you do psychotherapy, talk therapy, or you do, what are the modalities you use to use medication as well?
A kind of medication.
Yeah.
It's talked about the approach of thinking, the method of thinking.
Okay.
That's why we focus on exactly on rational thinking.
Yes.
That's why.
Correct. Okay, Julie.
Hello, I'm Dr. Aida Abu Salim. I'm a general dentist currently treating mouth breathing, snoring patients, and sleep apnea patients. Currently using laser devices such as the Snore 3, erbium YAG lasers to remodel the soft palate. Also using myofunctional devices and mandibular advancement devices.
Perfect.
Good evening. I'm Dr. Mohamed Kiswani. I'm a prosthodontist. Since 10 years, I'm focusing on dental sleep medicine. Actually, I'm working with a group of ENT and respiratory physician in my clinic to deal with sleep breathing disorders. We are doing treatment for sleep medicine as multidisciplinary approach because it's not just the surgery. We have to educate the orofacial muscles to stay in position and to create an equilibrium between teeth and orofacial muscles, and also to deal with our friends in ENT to open any nasal obstruction, because if is there a nasal obstruction or turbinate hypertrophy, we will not be successful dealing with cutting the mouth breathing habit. So the main scope for this topic, in my opinion, is to make your patient a nasal breather. If your patient is a nasal breather with the tongue in its proper position, with proper swallowing, you will do the job.
Man after my own heart. That's just, we got that on camera. Can you believe that? No. This is an ENT. How'd you get to be so smart?
I'm doing this since 15 years. I was practicing in Genoa University in Italy. First, I was taught by an ENT specialist, Professor Isabel Storcelli.
Yeah.
She is the inventor for the Nightlies, Fotona.
Yes, Fotona.
remodeling.
It's my favorite.
Yes, I was practicing with Isabel. Isabel, she taught me how to do these things. Then I worked with a dentist in Germany. He's called Dr. Darius Mortader. He is the inventor of the Darius Snore 3 appliance. Then I worked for, I think you know them in USA. They are the Healthy Start company.
Healthy
with
Stars, yes.
With Dr. Bergelsen.
Yep.
I was working with him for maybe 5 years. Then I worked with Dr. Dawson. I was the Dawson Academy representative
Yep.
in Middle East. So I was working on prosthodontic issues related to occlusion and airway. So that's why we end up with a protocol for CBCT airway endoscopy in order to use the CBCT for diagnosis and referring the cases to our colleagues in the ENT in order to improve the
So he's
quality of
already
our
on track. So like this is amazing. I mean, every single hit point that you hit. The only thing I'm adding to that, I connected a few dots to know in what order and how to actually address the problems from ground up and top down in what order for every patient.
Actually, I need to see because I worked with Healthy Start and also with my research company. I need to see what's the difference between the appliances because I
have that answer for you.
Start and I use also MyoBrace, and I'm teaching this for the students in Turkey. I'm teaching dental sleep medicine in Aydın University for the dental graduates in order to introduce them what's the airway. Now we have a new concept in dentistry. It's called prosthodontic airway.
Yeah.
Yes, this is a new topic in dentistry. It's a specialty that prosthodontist has to deal with airway, and Dawson has put this in his book in 1974.
Actually, my first introduction to airway was from Dawson Academy. Dr. Pete Dawson passed away, but his son-in-law
His son, yes, he's
has
now
taken
yes.
over, and Dwight has been promoting a lot of airway first. And I learned about that when I was pregnant with my daughter at the time. And then my daughter had sleep apnea, and I didn't know. I mean, what are chances? And then the reason why I got into this was exactly that. So thank you for saying it, because dentistry has been stuck where Pete Dawson left it,
Yes.
and now 3 decades later.
But now everything is, I think, it's
We're changing the
because
needle.
Dawson is now introducing this concept. His son
Yep.
is into the practice.
Yep.
This is Dr. Rania Nazal. I'm a pulmonologist in Jordan University Hospital. We treat patients, sleep apnea patients, but actually we treat them with CPAP. So I'm here to hear
She was like, that's
the other side of the story. I'm happy to listen to the old.
How young are your patients? How
all
young?
ages. Actually, we treat adults.
But like,
Okay.
what is the youngest that you treat with CPAP?
Whatever 20s.
Maybe you go for kids with CPAP.
And they really ask for other solutions.
Oh my
They hate
gosh.
CPAP.
You need to hear.
So
There's
I'm
other
here for the
solution.
miracle.
Well, thank you so much for coming tonight.
Yes, I don't listen to you.
I want to quench you guys' curiosity, and we want to make this a dialogue. I'm here to support you. So make it a dialogue. Please don't stay quiet, because I need engagement, and I need to know what questions revolve around your head so that I can we just finish? 2 doctors here And I really want to make sure that we hear everyone's story.
Yeah.
And more importantly, how did you find out that airway needs to be a part of your practice? I mean, that's a huge decision.
Yes,
Yeah,
yes,
tell
that's
me.
right. First of all, thank you for coming and sharing your expertise with us. My name is Asma Al-Btoush. I am a consultant pulmonary and sleep medicine at Jordan University Hospital. I am associate professor at medical school. I did postgraduate training in respiratory and sleep medicine at Australia for 3 years, and I have a good experience in sleep medicine. I am also a member of the Asian Academy of Sleep Medicine, which is we just got the approval for our curriculum for the Asian Academy of Sleep Medicine. Yes, with Professor Bahamam. I think you've heard of him. And the curriculum, by the way, we mandated that the fellowship training should have a dentistry rotation. Yes, yes, and we are just waiting for the recruitment for the staff member from all around Asian countries to start the fellowship program. I treat adult patients with obstructive sleep apnea. I have good experience in maybe choosing who are the patients who are candidate for mandibular advancement splint and other modalities. I have referred many of my patients for mandibular splint at Jordan University Hospital to our dentist colleague, but I was looking for someone who is really experienced in sleep medicine, who has a dentistry background, because I think this will make a difference. I don't think from the patients I have referred so far that I see a lot of improvement. I'm not happy with I referred maybe 5 of my patients. I don't think they are happy. And I want to know more about this modality. I know it works for moderate and mild sleep apnea, but I want to hear more about that.
Well, I got a very special treat just for you.
Thank you.
And in terms of adding